Hi, my name is Jennifer Wood, and I chose to do my pathology research paper on enchondroma. An enchondroma is a benign bone tumor that is formed from the cartilage and inside the medullary cavity. The medullary cavity sits within the diaphysis, or the shaft part of the bone. These tumors are often solitary, which means that they're found in one place throughout the body. There's just one tumor there. It's not uncommon, but it's less common for there to be multiple tumors throughout the body. When there are multiple tumors throughout the body, that's usually associated with the pathological variations of enchondroma. Two syndromes or diseases are the Aller disease as well as the Muffucci syndrome. Those go hand in hand with enchondromas because those are multiple enchondromas seen throughout the body. Those are created with a variation of a specific gene type, while as a solitary specific enchondroma is an idiopathic disease. An idiopathic disease is one without known cause. Enchondromas are being studied every single day. There's a lot of new research going out regarding enchondromas and how they are created. With that research done, there are theories as to how an enchondroma are formed, and they are as such. An enchondroma could be the result as increased cartilage growth, or instead of cells growing into cartilage, or they grow into cartilage rather than bone. Those are just a couple of the theories that researchers have come up with. There's not a set theory quite yet. The skeletal system is the system that is most affected by enchondromas, since they are benign bone tumors. A enchondroma mainly affects the hands and the feet, but it can be seen elsewhere in the body, such as the skull, vertebrae, or pelvis. When discovering a enchondroma on the skull, vertebrae, or pelvis, that's often an accidental finding, since it's usually a solitary tumor, and they're often asymptomatic. Subjectively, or described by the patient, pain is experienced in the area of the tumor, or objectively, swelling is very common as a result of the tumor. Depending on the location and the size of an enchondroma, fractures may form as a result of the weakened bone. Since the tumor sits within the bone, and it's a cartilage, it can make the bone weak, causing the fracture. Diagnostic imaging is a great tool in order to diagnose many different pathological diseases or syndromes. An enchondroma can be diagnosed on an X-ray, a CT, an MRI, a PET scan, or a nuclear medicine scan. Enchondromas are often first seen on X-ray, since they're often an accidental finding. Once they are found on an X-ray, it's not uncommon to get further imaging done. A MRI is often used to evaluate the soft tissue that is affected by the enchondroma. A CT gives a very precise size and location of a tumor. The PET scan or a nuclear medicine scan is a great tool to use to see the how much density the tumor has. The more dense the tumor, the brighter it shows up on a nuclear medicine scan. Since these tumors affect the bones and not the soft tissue, an ultrasound is not used to diagnose a enchondroma. Treatment-wise, treatment is not always necessary when talking about an enchondroma, since most go undiscovered and are often asymptomatic. Once diagnosed with an enchondroma, routine x-rays are often encouraged in order to monitor the size of the tumor, making sure it doesn't get bigger or more don't show up. The tumor itself has very precise lines since it is benign, and it's more obvious to differentiate a benign tumor with a malignant tumor using these other modalities as discussed. If an enchondroma is causing pain to the patient, it would be discussed with the physician to determine treatment plans. Depending on the location of the tumor, say if it's in the hand, pain injections can be into the joint space in order to alleviate pain. Curettage or removal of the tumor, where they scrape off the tumor from the bone, can be done based on the size, location, and the symptoms of the tumor. Following up from the removal of the tumor, it's very common to do a bone graft. The bone graft is done to ensure the stability of the bone after the tumor is taken out of it. The bone grafts can be done using a donor bone or the bone from a different area of one's body. If an enchondroma causes a pathological fracture, monitoring the area, casting, routine x-rays are often done to make sure the bone is healing correctly. Prognosis of a benign tumor is very positive. Since it is benign, it's not life-threatening. Most tumors are asymptomatic and go undiscovered. If the tumors are causing pain, surgery may be done, or injections into the site of tumor are used to alleviate pain often. The image on the left-hand side shows an x-ray next to a MRI showing an enchondroma of the 5th metacarpal. You can slightly see it on the x-ray, but to get a more in-depth image, the MRI was done, and we can also see if there was any soft tissue affected as a result of the enchondroma. This middle image here shows a CT done of a femur to see the enchondroma. The CT takes different slices of the image, as in sagittal or transverse, to get a really precise size, location, and depth of the tumor. And this last image on the right-hand side shows a small enchondroma of the 2nd proximal phalange of the foot. That's often an accidental finding if someone comes in with foot pain or if they twisted their ankle or something. An enchondroma can be found as accidentally as that. In conclusion, an enchondroma is a benign bone tumor that commonly goes undiscovered since they're more often than not asymptomatic. If they are symptomatic, it's very mild symptoms, as in soreness, difficulty bearing weight, which is a very extreme case, or just mild pain into the area. Men and women are equally affected by the tumor, but most commonly found in ages 10 to 20 years. Symptoms are often patient dependent, but swelling and pain are the most common symptoms expressed by an enchondroma. Treatment is not always necessary, but when it is, removal of the tumor and a bone graft is usually performed if the symptoms appear to be harsh enough to need that. This next slide here, I just have pictures of my references. This is where I got all my information from. Thank you for listening, and I hope you enjoyed this. Thanks.